Okay. Matthew, tell me a little about what happened with your mom over the past year and your perspective of what happened in the hospital.
Well, a year ago, she was much more mobile, walking around with a rollator. When I came to see her in December and January, she was much less mobile, especially like getting up, rocking herself up to transfer. And I was concerned during the whole month of February that maybe it was unstable and dangerous, like a risk of fall. She did slip a couple of times, and then on March 4th, she fell. And we didn't take her to the hospital that day. We waited until the next day, and the pain got worse, and there were no fractures. But the pain increased. The sprain, culminated the next couple of days, and she was in excruciating pain. Unfortunately, the aides that we hired to take care of her didn't really know how to avoid getting the pressure ulcers on her feet. So she developed 2 pressure ulcers within the first couple of weeks. And then at the same time, we were in the process of hiring a care manager because I was consulting with my ex-wife, who's a family doc, and she said a care manager could do a lot to manage the pain, coordinate the doctors. So during this whole process, there's been all this change going on in terms of how to manage her care. But basically, we got her started on regular pain meds for the first time in her life, and we got her ambulating with the physical therapy just a few weeks ago. Started to do that. We have a personal trainer to fill in the gaps when she's not getting the physical therapy. But she had a couple of setbacks after the fall. She had very low blood iron because of a prescription that her PCP gave her. Apparently, was giving a slow bleed. So we had to take her to the hospital because that's the only way you can do a blood transfusion is inpatient. So that was kind of traumatic. But we got her out of there within 24 hours. Then she could have gone to the hospital another time with the leg infection, but fortunately we were able to bring the hospital to her because our care manager, supervisor, Bo, knew about Care2U, which is a great service. They come in, they do the IV drip, they do radiology, any other tests, sonogram, we did it all. They came to us, and that was very, very, very helpful. And then they follow up afterwards, after they're discharged. So she's finally rounded a corner, I think, because she hasn't had any additional complications for the past month. So she's been able to focus on getting better. So she's ambulating better, a lot better, and she's transferring better. And so we're just onward and upward, see what we can do. See if we can get her a new body. She keeps on asking for a new body every once in a while. Maybe we can get one for her.
Are there any things you would have liked, if you go back in time, you would have done differently?
Absolutely, yes,
Okay.
yes. So depends how far back you want to go, like a year, 6 years, 20 years.
I would say a year to 2 years would be good.
Yeah, for me, I don't know about my brother John or David, but for me, very deferential to her preferences in terms of doing things or just being left alone. I would have been much, much more proactive because it's just hard psychologically to go against what your mom's telling you to do because your mom's been telling you what to do for 58 years now. So to like reverse the role a little bit and say, no, maybe we should do it differently. It's just psychologically different. So I would have changed that mentality a long time ago.
Okay.
Yeah.
What do you think? What are the things that you've done over the past, say, three months that you think has been really great and has really helped her turn around?
Good question. Well, first, hiring Chris School, the physical trainer, because part of the problem with her getting more mobile is just the pain and the stiffness and the lack of strength in the knees and stuff like that. And Chris is really good at setting her up to be able to get beyond that. He ices, he applies heat, he does this sort of, it's not really a massage, but just sort of a loosening of the muscles, and even before he does any exercises. So that's been very helpful. I think it's enabled her to really advance quickly in the physical therapy because they've been very impressed with how quickly she's advanced. So I think that's very complimentary. Hiring the care manager was key. So Granny sometimes says it's a waste of money. Why do you have a care manager? the care manager, after just 3 weeks, had recommended that she take Tylenol, 3,000 milligrams, 6 pills a day. And that was like the crack in the iceberg. It finally allowed her to get some sleep at night. That was the biggest issue. She never got any sleep. 2, 3, 4 hours if she was lucky. And then with the Tylenol, she actually started to sleep a little bit better. And then that opened the door up for gabapentin. Doctors have been recommending the gabapentin for years, and she was never open to it until me and Bo pressured her into it, and she finally started taking it. And that's helped too, I think. And then we added the compound creams. So just the pain management, the care management, the physical training, just every day figuring out what's going on and responding to it and being very aggressive about it in general.
That's great. Now, if other people, were in the same shoes as you, managing their mother or father, what advice would you give to them? And it can be brief. It doesn't have to be long.
If something's bothering you and you're wondering, should it be this way? Is there a better way of doing it? Don't ignore that feeling. Like follow up on it. If you don't get satisfactory answers from the PCP or from the nurse or from anyone, do your own research and reach out to someone who actually has some expertise in geriatric care,
Okay.
Elderly care, until you get the answers that you feel comfortable with. Don't just ignore any misgivings you have. Actually follow up on them until you're satisfied.
So what I'm hearing is you feel a family should be very proactive in terms
Absolutely.
of managing their loved one and not
Yeah.
just accept,
Right.
what they're told by either a healthcare provider or someone else.
And maybe there's something that can be done, but
Okay.
usually there is something that can be done. It's actually surprising how much you can do.
Absolutely. That's great.
Yeah.
Thank you. Thank you, Matthew.
Yeah.